Welcome to the deep dive, everyone. Ready to learn some stuff about kidneys?
Always ready.
Okay, awesome. So today we're diving deep, no pun intended, into these incredible organs. Kidneys. They work so hard to keep us healthy. And we've got some seriously detailed medical documents about what happens when they, don't. Acute and chronic renal failure. That's the focus.
Yeah, renal failure, it can be pretty scary stuff.
For sure. So by the end of this deep dive, you'll not only understand how your kidneys work, but also you'll be aware of some common problems that can pop up. Sound good?
Sounds like a plan. Let's do it.
Awesome. So maybe we should start with the basics, just to get everyone on the same page. We hear about acute and chronic renal failure all the time. What's the real difference?
Okay, well, think of your kidneys like a really sophisticated filter.
Okay, I like that.
Yeah, like a machine with like all these intricate parts. Now imagine that machine suddenly breaking down. Boom! That's acute renal failure. It's a rapid decline in how well your kidneys are working. But the good news is it's often reversible, if it's caught and treated quickly.
That's good to know.
Yeah. And then on the other hand, you have chronic renal failure. Think of it like the slow wearing out of that machine. Over time, prolonged damage.
Oh, okay. So it's kind of like a sudden breakdown versus like slow wear and tear.
Exactly.
The machine analogy really helps me visualize it.
Very good. Glad to hear it.
So if acute renal failure is like that sudden breakdown, what could cause something like that?
Well, one surprising culprit is contrast dye, the kind they use in some medical scans.
Oh, wow. I didn't know that.
Yeah, it can be really tough on the kidneys, almost like cement for those delicate filtering mechanisms.
Wow. Cement.
Yeah, so it's super important for doctors to really weigh those risks and benefits before ordering those scans, especially for folks who might already have kidney issues.
That's a really good point. So even something that seems harmless, like a medical scan, could have unintended consequences. It makes you realize how important it is to be informed and advocate for yourself when you're making medical decisions.
100%.
So we talked about contrast dye. What are some other things that can cause acute renal failure? I know the documents mention something about pre-renal, intrarenal, and postrenal causes. What do those even mean?
All right, so those terms basically describe where the problem starts. Pre-renal causes, those are issues that happen before the blood even gets to the kidneys.
Okay.
Imagine a kink in a garden hose.
Okay.
It's stopping the water from reaching the sprinkler, right?
Right.
So with pre-renal causes, it could be a blockage in a blood vessel, really low blood pressure, or even a heart that's not pumping blood strong enough.
So it's all about the blood flow to the kidneys.
Yeah, the kidneys need that constant supply of blood to do their job.
Got it. So if pre-renal is all about problems before the blood gets to the kidneys, then intrarenal causes must be issues inside the kidneys themselves, right?
You got it. Exactly.
So what kind of problems happen inside the kidneys?
Well, with intrarenal, we see damage to those internal structures of the kidneys, those delicate filtering parts. And this damage is often caused by things like certain medications or infections.
Oh.
Like certain antibiotics. They're great at fighting infections, but man, they can be really harsh on the kidneys.
Oh, wow. So it's like a trade-off, almost.
Kind of, yeah. Like using a super strong cleaner that, yeah, it gets rid of the dirt, but it can also damage the surface you're cleaning.
I see. So with medication, it's all about weighing the benefits against the potential risks.
Absolutely.
And it's super important to talk to your doctor about those risks and maybe, see if there are any other treatment options.
Definitely. Don't be afraid to ask questions. Informed patients, they make the best choices about their health, no question.
Absolutely. Now, we talked about problems before the kidneys and within the kidneys. What about postrenal? Is that after the kidneys?
Bingo. You got it. Postrenal causes, those are all about obstructions after the kidneys. Think blockages. In the ureters, the bladder, or the urethra, like a traffic jam backing up the whole system.
Okay.
If the urine can't flow freely out of the body, it puts a lot of pressure on the kidneys. And that can cause damage.
This whole machine analogy is really clicking for me. It's making everything so much clearer.
Yeah.
But how would you even know if your kidneys were in trouble? Are there signs you should watch out for?
Oh, yeah, for sure. There are definitely some red flags. The documents mention some specific lab values like creatinine and BUN.
Okay.
Those are waste products that the kidneys should be filtering out. So high levels of those in your blood, that can be a sign of a problem. Another big one is your urine output. How much you're peeing, basically. If you're suddenly going less often, or if your urine looks really dark or concentrated, that's a red flag. It's called oliguria. Basically, your body trying to conserve fluid because the kidneys aren't filtering as well as they should be.
Wow, so even something as simple as going to the bathroom can give you clues about your health.
Exactly. Your body's always talking to you. You just got to learn how to listen.
That's a good point.
Mm.
Okay, so let's shift gears a bit and talk about chronic kidney disease. Remember we were talking about how it's like that slow wearing down of the filtration system.
Right.
So what contributes to that? Like what causes that kind of long-term damage?
Well, it's kind of like think about what happens to a car engine. If you're constantly redlining it, pushing it too hard, it's going to wear out a lot faster, right?
Yeah, makes sense.
Same thing with your kidneys. Two of the biggest culprits are uncontrolled diabetes and high blood pressure.
Yeah, I've heard that before.
Over time, high blood sugar, high blood pressure, they damage those tiny blood vessels in the kidneys. You get scarring, reduced function. It's not good.
It's like they're under constant attack. Eventually, they just can't keep up.
Right. So managing those conditions, it's key for preventing long-term kidney damage. Prevention is the best medicine.
Absolutely. But I guess even if you're doing everything right, lifestyle-wise, managing those chronic conditions, there could still be other factors at play.
Oh, yeah, for sure. Genetics, for example. The documents mention something called polycystic kidney disease.
Polycystic, what's that?
I'll be honest, I wasn't super familiar with it either. It's a genetic disorder where these cysts grow in the kidneys and they disrupt how the kidneys work.
So even if you're doing everything right, you could still have these underlying genetic factors you can't control.
Yep, that's the tough part. But hey, knowledge is power, right? The more we know, the better equipped we are to make informed decisions.
For sure. So let's talk about how this wearing down, this chronic kidney disease, actually shows up. Like, how do you know if your kidneys are in trouble? What are the signs?
Well, one of the first things you might notice is a change in how often you pee. If you're suddenly going less, or if your pee is super dark or concentrated, that's a red flag. It's called oliguria, that low urine output.
Oliguria. Got to remember that one.
Basically, it means your body's trying to hold on to fluid because the kidneys aren't filtering as well.
Wow, so those bathroom breaks we take for granted can actually tell us a lot about our health.
You got it.
What if you miss those early signs, though? What happens as the disease progresses?
Well, as kidney function goes down, you start to see waste products building up in the blood. Remember those lab values, creatinine and BUN?
Uh-huh.
Those levels start climbing, and that buildup can lead to a whole bunch of symptoms. Fatigue, nausea, itchy skin. It's not pretty.
Yeah, and that's when things can get really serious, right?
Yeah.
The documents even mention something called uremic frost.
Yeah, uremic frost. It sounds kind of sci-fi, right? But
Yeah.
it's real. It's when waste products actually crystallize on your skin. Crazy, right?
That's wild. So basically, your body's so overloaded with toxins, they start coming out through your skin.
Pretty much. Another common symptom is anemia, low red blood cell count. You see, the kidneys, they produce this hormone called erythropoietin, EPO for short.
All right.
It stimulates red blood cell production, but when the kidneys aren't working well, EPO production drops, and you end up with anemia. Hence, the fatigue.
So that feeling of being constantly tired, it might not just be because you're busy. It could be your kidney sending a signal.
Exactly. It's always worth getting checked out if you're feeling run down all the time.
Okay, so I've talked about all these different symptoms, but the documents also mention potassium as a big concern with kidney problems. Why is potassium so important in this context?
Right, potassium. It's one of those things, it's essential for our bodies, but too much of it can be a real problem, especially if your kidneys aren't functioning properly.
Okay, so it's like a Goldilocks situation.
Exactly, got to get it just right. Potassium is crucial for muscle contractions, nerve impulses, even regulating your heartbeat. Our bodies need a specific balance, and the kidneys, their job is to maintain that balance.
Okay, so what happens when the kidneys can't keep up?
Well, when kidney function is compromised, potassium can build up in the blood. It's called hyperkalemia, and that can be really dangerous.
How so?
Too much potassium messes with the heart's electrical signals. You get irregular heart rhythms, arrhythmias. In severe cases, it can even lead to cardiac arrest. Scary stuff.
Wow. So potassium, it's essential, but it can also be deadly if your kidneys aren't doing their job.
Right. The documents actually mention peak T waves on an EKG as a sign of hyperkalemia. It's like a visual red flag that something's wrong.
Okay, so we've got all these potential problems: acute renal failure, chronic kidney disease, potassium issues. What can be done to manage these conditions?
Well, there are different approaches depending on what's going on and how severe it is. For acute renal failure, the focus is usually on fixing the immediate problem, like if there's a blockage, removing it, or if it's an infection, treating that with antibiotics.
Okay.
But with chronic kidney disease, it's more about slowing the damage and managing the symptoms. It's a long-term game.
Right. So the documents mention diet as a key part of managing chronic kidney disease.
Mm-hmm.
I guess the idea is to, like, give the kidneys a break.
Exactly. A renal diet typically involves limiting certain things: sodium, potassium, phosphorus, even protein.
I see. Less work for the kidneys to do.
Yeah, it's like giving them an easier workload, less to filter, less stress.
So it's not a cure, but it helps slow things down and improve quality of life.
Exactly. It's about working with your body, not against it. But of course, sometimes diet alone isn't enough. What happens then? Well, that's when we start talking about dialysis.
Dialysis. Yeah, I know it's a treatment, but I don't really understand how it works.
So dialysis, it's like an external kidney, a machine that filters your blood when your own kidneys just can't do it anymore. Pretty amazing technology, really.
Wow, so it's literally doing the job of the kidneys.
Yeah, it's a lifesaver for people with end-stage renal disease, helps remove those waste products, excess fluid, keeps them alive.
That's incredible. But it sounds pretty intense.
Mhm.
What's it like for the patients?
It's a big commitment. Most patients have to go to a special center, like several times a week, hook up to this machine for hours.
Oh, wow.
It can really disrupt their lives, but it's necessary. It's what keeps them going.
It must be a huge adjustment, physically and emotionally.
Yes, it definitely is.
I know the documents also mentioned kidney transplantation. Is that an option for everyone with end-stage renal disease?
I wish it were, but unfortunately, no. There are a lot of factors that determine if someone's a good candidate for a transplant: their overall health, blood type compatibility, and even just the availability of donor organs.
Right, there's a huge shortage of organs.
It's a long waiting list, and not everyone makes it.
It really makes you appreciate the generosity of organ donors and their families. It's such a selfless act. One thing that kind of surprised me in the documents, though, was that you can still have acute renal failure even after a successful transplant.
Yeah, that's true. Even with a healthy new kidney, sometimes the body rejects it. It's like the immune system sees it as a foreign invader and attacks it.
Oh, wow, I didn't realize that.
It's one of the biggest challenges with transplants. Doctors use these immunosuppressant drugs to try and prevent rejection, but, there are always risks with any medication.
So it's like this constant balancing act, trying to suppress the immune system enough to protect the new kidney, but not so much that the body's defenses are totally down.
Exactly. It's a delicate balance. And even after a transplant, patients need close monitoring, to make sure everything's working as it should be.
Well, we've covered a lot of ground today, from how the kidneys work to the different types of renal failure and the treatments.
Yeah, it's been a deep dive for sure, but hey, kidneys are important. They deserve our attention.
Before we wrap up, I just want to circle back to something we talked about earlier. Those early warning signs of kidney problems. It seems like catching those early on can make a huge difference.
Absolutely. Early detection is key. Pay attention to any changes in your urination. Are you going less often? Is your urine darker or foamy? Any pain when you pee? Those are all things to watch out for.
Okay, good to know.
And also, keep an eye out for persistent fatigue, swelling in your legs or ankles, even unexplained nausea or itchy skin. Could all be signs of kidney trouble.
It's so easy to just ignore those little things, but it's really important to listen to your body.
I couldn't agree more. Your body's always sending you signals. And if you notice anything off, especially with your kidneys, don't wait. Go see your doctor. Simple blood and urine tests can tell you a lot.
Knowledge is power, right?
100%. The more you know about your body, the better you can advocate for your own health.
Well said. And on that note, I think we've reached the end of our deep dive into renal failure. Hopefully everyone listening feels a little more informed, maybe even a little bit empowered to take charge of their kidney health.
That's what we hope for.
If anyone has any concerns about their own kidneys, don't hesitate to reach out to a medical professional. Until next time, stay curious, keep learning, and take good care of yourselves. We'll see you on the next deep dive.